Are you getting ready for your very first nursing job interview? This is your moment to shine, not just with knowledge, but with confidence, communication, and care. In this video, you'll learn 30 of the most common interview questions for new nurses, plus how to answer each one clearly, professionally, and with heart. Let's get you ready to impress.
Can you tell us what motivated you to choose nursing as a career?
I've always loved helping people, but it was volunteering at a children's hospital that truly inspired me. Seeing how nurses supported patients emotionally and physically made me realize I wanted to make that same impact. What if a patient refuses to take their prescribed meds?
I'd ask them why, listen carefully, and explain the importance of the medication. If needed, I'd involve the doctor. The goal is to respect the patient's concerns while ensuring safe care. Have you ever had to make a quick decision during clinicals?
Yes, once during my ER rotation, a patient's condition deteriorated rapidly. I quickly alerted the senior nurse, started monitoring vitals, and helped with oxygen. Staying calm helped me act fast. What do you think your nursing professors would say about you?
They'd say I'm thorough, compassionate, and dependable. I was always eager to learn and took initiative, especially when it came to patient comfort and communication. Nursing can be stressful. How do you manage it?
I breathe deeply, stay focused on one task at a time, and ask for help when needed. Afterward, I take time to reflect and decompress. Stress is real, but staying grounded makes a difference. What would you say is your biggest strength?
Empathy. I genuinely care about people. Patients can sense that, and it helps build trust and improve care outcomes. What's a weakness you're currently working on?
I tend to overthink things, especially new procedures. I'm learning to trust my training, ask questions when unsure, and stay confident in my clinical decisions. Have you looked into our hospital?
Yes, I know your facility is recognised for patient-centred care and innovation. I admire your community outreach programs and would love to be part of a team that prioritises both compassion and excellence. How do you handle multiple tasks at once?
I prioritise using the ABCs: airway, breathing, circulation. I stay organised, write things down, and ask for backup when needed. Clear communication and time awareness help me stay in control. Tell me about a difficult moment during your clinicals.
I once cared for a patient who was non-verbal and very anxious. It taught me to rely on body language, eye contact, and gentle reassurance. I learned how important patience and observation are. What would you do if you saw a fellow nurse make a medication error?
I'd address it immediately to ensure patient safety. I would alert the supervisor or follow the reporting protocol. It's about protecting the patient, not blaming someone. What draws you to this department or specialty?
I've always been passionate about pediatrics. During my rotation, I connected with children and their families, and I saw how rewarding this work can be. I'd love to grow in this area. How do you define being a patient advocate?
It means standing up for the patient's needs and wishes, especially when they can't speak for themselves. It's about ensuring their dignity, comfort, and safety at all times. What if a physician brushed off something you felt was important?
I'd respectfully explain my observation again, backed by facts. Communication is key, and I'd escalate if necessary, but always with professionalism and the patient's safety in mind. Are you flexible with working different shifts?
Yes, I'm open to day or night shifts. As a new nurse, I'm prepared to adapt to the team's needs and learn from different experiences. What's your routine at the start of a shift?
I arrive early, review my assignments, and check patient charts. I introduce myself to my patients and prioritise tasks. A good start helps everything run smoother. Tell me about an ethical situation you've encountered.
During clinicals, a patient's family asked for info the patient didn't want shared. I spoke with my supervisor and followed the confidentiality policy. Respecting the patient's wishes comes first. What's your approach to infection prevention?
Hand hygiene is a top priority. I follow protocols strictly: gloves, PPE, and proper cleaning. I also help remind others, because infection control is everyone's responsibility. Why should we choose you over other new nurses?
I bring both heart and hard work. I'm eager to learn, a strong team player, and deeply committed to patient care. My passion shows in how I connect with people. What does nursing represent to you?
Nursing is service. It's using knowledge, compassion, and patience to care for others, especially when they're most vulnerable. It's more than a career. It's my calling. What's your strategy for staying on top of your tasks when things get hectic?
I write everything down: med times, patient needs, tasks. I prioritise what's urgent and constantly reassess throughout the shift. Staying calm and structured helps me manage chaos. How do you support patients who are distressed?
I listen first. Just being heard helps. I speak calmly, explain what's going on, and reassure them they're safe. Empathy and patience go a long way in building trust. What's your reaction to constructive criticism?
I see it as an opportunity to grow. I stay open, take notes, and reflect on how to improve. Feedback helps me become a better nurse. How do you approach family members going through loss?
With compassion and presence. Sometimes it's not about words, it's about being there, listening, and offering comfort. I stay respectful and supportive. Are you more of a team player or an independent worker?
Both. I can handle my responsibilities independently, but I believe strong teamwork improves patient care and makes shifts smoother. What's your approach to continued learning?
I follow trusted medical journals, take part in workshops, and love learning from experienced staff. Nursing is always evolving. I want to grow with it. How do you show empathy while staying on schedule?
Even small moments, eye contact, a gentle tone, a few kind words can mean a lot. I stay efficient but never robotic. Compassion is part of quality care. What if you realised you made a clinical error?
I'd report it immediately. Being honest protects the patient and shows integrity. Then I'd learn from it and make sure it never happens again. What's your long-term goal in nursing?
I'd love to become a charge nurse or specialise in critical care. I'm committed to growing, mentoring others, and making a bigger impact over time. Before we wrap up, do you have any questions for me?
Yes, I'd love to know more about how your team supports new graduates and what your mentorship structure looks like. I want to keep learning and contributing.
You've just practiced 30 real interview questions, and now you're ready to walk in with clarity, compassion, and confidence. Remember, hospitals hire more than resumes. They hire people who care. If this helped you, be sure to like, subscribe, and share it with a fellow nurse. Your career in healthcare starts now.